Okay, so this is gonna be part 2 because my video did cut off. So just gonna pick up where I left off. The other video finished with me spreading, and so I'm just gonna pick up there. So I do have my sterile gloves on, and her drape would not be this far down. It has fallen a little bit, but it's okay. So just getting a little bit closer and picking my, I did not contaminate my gloves because I did not touch anything that was not sterile. And if I did, I would, of course, change my gloves. So, I have my lubricant on my Foley catheter. So now I'm going to begin insertion, spreading, and placing it in the urethra. Reminding my patient to take deep breaths, and I would of course not force the catheter, but you do insert until you have urine outflow, which I have urine outflow, so I'm just going to advance just a little bit further, and then I'm going to insert my 5 milliliters because this is a 5 milliliter catheter. Okay, and then I will just remove. And I will tug on it to see that the balloon is in place, which it is. So now I would, of course, I can use this clamp and clamp it to the bed sheet, or I can get a stat lock that will place it to her leg and it will secure the tubing. Then I will place the bag down below her, facing out so that it can be read, and with dropping below the sterile field and moving around, I would take my sterile gloves off, but for demonstration purposes, since I have to keep reusing these, I'm just going to leave them on. So I would begin to discard of my supplies and make sure that my patient is not in any pain. If there's anything I can get her, and tell her that I will come back and check on her in a little bit. And I would, but before I did that, I would rip this and pull it off, but for demonstration purposes, we have to reuse this, so I'm not going to be ripping it. So I would just be pulling it off, and then I would pick this up from under her as well and discard. And then of course, discard my gloves and perform hand hygiene, cover her back up, make sure she's comfortable, and I would raise the head of the bed back up because we did lower her earlier. To place the catheter in a supine position, lower her legs, and assess for comfort. Thank you. Oh.